This is what happens before doctors finally confirms the patient death. But before the death confirmation starts, doctors must ensure that three of these things, at least one, is fulfilled. First of all, the doctor has to make sure that the patient is not for resuscitation. And also, the doctor has to check whether an attempt for a resuscitation like CPR has already failed. And lastly, the doctor has to also check whether life-saving treatment has been withdrawn by order from maybe the patient's significant others. Okay, so before the doctor approaches the patient, the doctor has to wash his or her hand and wear PPEs if it is appropriate. So having said that, the doctor will check some of these things before the confirmation starts. First of all, the doctor will check for central pulse. Most often is the carotid pulse. Then again, the doctor will check for heart sounds, also by merely auscultation by a stethoscope placed on the chest to listen to the heart, whether there is a heartbeat or not. Respiratory sound is also checked by auscultation. That is also important to check for any signs of breathing. Then lastly, the doctor will check for any signs of movement. That's any sign of life. So if there is life, there will be movement. So the doctor will observe any signs of movement by eliciting pain or any other triggers to be able to find out if there will be movement by the patient. So once the doctor confirms there is no sign of life, then he proceeds to the next phase. So after 5 minutes of checking for cardiorespiratory arrest, you also check for absence of bilateral peripheral reflex by using a pen touch on both of the eye. And then also you also check for bilateral absence of corneal reflex. And then lastly, you check for absence of motor response by the patient. Mostly the motor response is triggered by supraorbital pressure. Okay, so the doctor will use supraorbital pressure to check for movements or motor response by the patient. So when all these things fails, then the doctor will proceed to the last phase. On checking for the bilateral peripheral reflex, mostly when the patient is dead, you see that the pupil will be fixed and dilated, unlike a normal pupil that normally react to light by constricting, so it becomes a pinhole. On the other hand, if the patient is dead, it's the opposite. There will be dilated and fixed pupil on both eye, and that should be a key sign that life is gone. So the tutorial video gives an overview of everything that I've spoken about. When you take your time and you go through it, you understand each step. So from phase 1 to phase 2, and then the last phase where the doctor declared that the patient is finally dead, and then a note should be written in the bold statement to declare that the patient is dead at a set time and date. So the next time you hear that the patient is dead, you don't just confirm that the patient